Meet Arnold, a 58-year-old who took too large a bite of steak, laughed at the dinner conversation, and suddenly grabbed his throat. Notice, Arnold is choking. He can't speak or make any sound. His neck and chest muscles strain with every breath. His nostrils flare, and the skin around his collarbone and ribs pulls inward as his body struggles to move air. Stridor may be audible. His heart races, he grows restless, his lips and fingertips begin turning blue, and his consciousness starts to fade. There's no time for labs or imaging. Interpret. Arnold has a complete airway obstruction, a piece of steak lodged in his trachea, blocking all airflow to his lungs. The cascade is swift. No airflow means no oxygen, leading to cellular death and organ failure, starting with the brain and ending in respiratory and cardiac arrest. Airway obstruction can also result from swelling due to croup, asthma, or allergic reactions. Respond. The critical first step is the abdominal thrust maneuver. Standing behind Arnold, his daughter places a fist above his navel, grips it with her other hand, and delivers firm upward thrusts to force the steak out. If alone, Arnold could perform it on himself or lean over a chair for support. If swelling were the cause, EMS would give epinephrine and steroids to reduce it. If the airways still can't open, providers may perform a cricothyroidotomy or tracheostomy or intubate with respiratory arrest. Every option must work within that narrow 3 to 5 minute window. For prevention, patients with dysphagia should undergo a swallow study before eating. Reflect. If the Heimlich works, the steak dislodges, Arnold gasps for air, his color returns, and his heart rate settles. If not, he progresses to respiratory arrest and cardiac arrest. Survivors can still suffer permanent brain damage if oxygen deprivation lasts too long. In summary, airway obstruction is a blockage of the trachea that prevents oxygen from reaching the lungs, leading to cellular death, brain damage, and cardiac arrest within minutes without treatment. It presents with inability to speak, stridor, and cyanosis. It is treated with an immediate abdominal thrust maneuver. If you study to remember, you will forget. But if you study to understand, you will remember. Author unknown.